Hi, I'm Sheryl Sullivan, and I'm doing my head-to-toe assessment for my professor, Dr. Wendy Hannon. This is Kate, who has volunteered today to help me. Thank you, Kate. Now, I have looked over your medical history, and I see that you have no allergies, and you're not on any medications, and you've had no past surgeries. Is that correct?
Yep.
Okay. So the first thing I'm going to do is wash my hands. So at any time when I, touch anything, if anything's tender or sore, or if you need me to stop, just let me know, okay?
Okay.
All right, so the first thing I'm going to do is I'm just going to just take a look at your hair and your scalp, okay? I'm looking for any bumps or masses, dry skin. I don't see anything at all. Your hair is nice and shiny. Your skin is nice and pink on your face and on your upper extremities, okay? I'm just going to take a look inside your eyes, okay? I'm just looking at your sclera. They're nice and white. I don't see any discharge at all. I'm going to have you try to keep your eyes closed while I try to pull them open. Very good. Your nose is nice and symmetrical. Your eyes are symmetrical. And your ears are nice and symmetrical, okay? I'm going to have you cover one nostril and breathe through the other one, okay? And then the next one. Any problems with that?
No.
Okay, great. I'm just going to take a look. I'm going to take a look in your ears. Okay. Going to pull on this, and I don't see any abnormalities with your ears. Okay, everything looks good. I'm going to have you open up your mouth. Okay, I'm going to have you say ah. I see your uvula and your tonsils. Your uvula is nice and midline. Go ahead and open up again. I'm just looking at your mucosa. Could you just lift up your lips so I could look at your mucosa a little bit better? Okay. And what I'm going to do is I want you to try to open your jaw. Nope, try to keep it closed. And then, yeah, you keep it closed, I'm trying to open it. There you go. Very good. All right. And next thing I'm going to do, Kate, is I'm just going to shine the light right on the bridge of your nose. I just want you to stare right at me, okay? I'm just checking your corneal reflex, okay? And just continue looking straight at me. Okay, I'm just checking your pupils. They're nice and round. They're reactive to light and accommodating, okay? And that's called perla. All right. Next thing I'm going to do is I'm going to feel for any lymph nodes, any tenderness.
No.
Okay. Nothing hurts when I do this?
No.
Okay. All right, I'm just going to come around the back. And again, I'm just looking at your back, and normally you would have a Johnny on and I could see your skin, but I don't see any abnormalities with your back. I don't see any lumps or bumps. Okay, I'm just going to reach around and I'm going to just palpate your thyroid. I'm going to have you swallow. And one more time. Thank you. And now I'm just going to check your trachea and just note the midline, okay? And that's nice and even, okay? Next thing I'm going to have you do is I'm going to have you just show me the range of motion with first your shoulders, and now go forward for me. Okay. Don't let me. Go ahead and try to lift up your shoulders. Okay. And then what I want you to do is just lift up your arms straight, and then up, and then put them behind your head, and then back down. And behind, okay, and then straight down again, okay? The next thing I'm going to do is I'm just going to just check for your pulses. Good. Nice strong pulses. I'm going to have you put your hands up and down, okay? And I'm going to have you spread your fingers apart. And I'm just looking for any skin breakdown in any of your fingers, and I don't see any. And I'm just checking your capillary refill. Okay, great. Now if you could hold your hands up, okay? Don't let me pull them down, and then put your hands down and try to lift them up. Okay, very good. If you could just hold your arms out and don't let me push them down, and then again, don't let me push them up. Okay, very good. Next thing I'm going to do is just describe, we would normally do the gag reflex, which is a tongue depressor. And I would have you say ah, and I would put that back in the back of your throat and push down your tongue and get the gag reflex, but I'm not going to do that today, okay? I already checked your mouth, okay? I'm going to palpate your sinuses next, okay? I'd like you to tell me if you have any tenderness, any tenderness there at all?
No.
Okay, great. All right. What I'm going to do now is I'm going to have you do a little reading test. Okay. Normally what we do is a Snelling test, which is a piece of paper with some words and letters, and that's set 20 feet away. We don't have that here today, so I'm just going to have you block one eye, and I'm just going to have you read one of the sentences.
Anything else on the outside?
Okay, and now same thing with the other hand.
The reality is.
Okay, so what that means is you would be able to read 20 feet away, which is what most people can do. So you have 20/20 vision. All right. The next thing I'm going to do is what's called a whisper test. I'm going to have you block one of your ears, and I'm going to come over here and just whisper something to you.
It's Wednesday and it's raining. I don't know, just make something up.
Okay, all right, thank you very much. Okay, so now what I'm going to do is I'm going to listen to your lung sounds, and I'm going to listen to your heart sounds. First, I'm going to come around the back and take a listen. All right, go ahead and take a deep breath. Okay, very good. And I'm just going to have you just lean forward a little, okay? And just going to note your spinous process is nice and equal. And I'm going to just check the equal of your chest cavity. So go ahead and just take a deep breath for me. Okay, and that's nice and equal. All right. Next thing I'm going to have you do is I'm going to do a couple of eye tests, okay? What I'm going to do is, I already checked your cornea reflex, did I? I did, okay. So I'm going to have you just cover one of your eyes, okay? I'm going to cover the same one, and when you see the flashlight come into view, just look straight at me. When you see it come into view, just say now, okay?
No. No. No.
Okay, the other one?
No. No. No.
Okay, great. All right. And, okay, I'm just gonna check the strength of your hands. So if you could just squeeze my hands really tight, good. And just hold your hands out. Don't let me push them down, and then don't let me push it up. Perfect. Okay. I checked for your any lymph nodes. Now I'm going to listen to your lung sounds in the front, okay? So again, I'm going to have you take about 10 breaths. Okay. Now I'm going to listen for your heart. I'm going to listen to it on several different places, and I'm going to use the diaphragm and the bell, so it's going to seem like I'm doing it a lot. Just breathe regular. I'm going to just have you lean to the left. Very good. And we do the same thing with using the bell. And then just lean down. And I'm going to listen for 15 seconds to the apex. Very good. Okay. Now what I'm going to have you do is I'm just going to have you lie flat. Actually, I'm going to have you lie at a 45-degree angle first. And I'm just going to be looking for any pulsations in your neck. Okay. I'll see any vascular pulsations in your neck or your chest. Come around this side and check this side. Just turn your head that way for me. Perfect. And nothing else noted. Okay. So now what I'm going to do before I lie you down, I'm just going to check for any tenderness in your kidney area. So if you could just sit up for me for 1 second. And I'm just gonna palpate back here on your kidneys. Any tenderness when I do that?
No.
Okay, great. Go ahead and lie back. I'm gonna lie you flat now. Okay. So what I'm gonna do is I'm just gonna look first, okay? I'm looking for any pulsations in your abdomen, and everything looks good. Okay, I don't see anything abnormal. So I'm going to listen for your bowel sounds now. press? Any tenderness when I do that?
No.
Okay, any tenderness when I do that?
No.
Okay, great. Now what I'm gonna do, Kate, is your skin is nice and warm, right? And I'm gonna check the warmth of your skin in your lower extremities. And your skin is nice and warm. Your hair distribution is fine. I'm gonna take off your socks. Okay, and what I'd like you to do is I'm gonna have you lift up one leg one at a time as high as you can go, and then down. Okay, and then I'm gonna have you lift up one leg and bring it out, and then back over that one. And if you could do the same thing to the other leg. Okay, now I'm gonna have you bring your leg up and put it on your knee and run it down your shin, and do the same to the other one. Okay, now I'm gonna have you bring your knee up. Okay, and I'm just gonna check that. No pain with that?
No.
Okay, and do the same with this one. Any pain with that?
No.
Okay, great. What I'd like you to do is I'd like you to lift your feet up. Now put your feet down and turn your feet outwards, and now turn your feet inwards. Great. I'm going to have you try to push on me. Okay, and now try and pull me up. Okay, great. Wiggle your toes and roll your toes up, and now push them up and wiggle them one more time. Okay, and now if you could spread your toes out, just looking for any skin breakdown, and I'm going to check your capillary reflex. Your capillary refill, sorry. Okay, great. Now I'm going to check what's called the Babinski reflex. Okay, ticklish, huh? All right. All right, so you can go ahead and you can sit back up. Okay. Oh, I forgot to check your for TMJ. So go ahead and open your mouth and close it, and then put your teeth back and forth like that. Great. And I'm just gonna check your temporal artery and your carotid arteries. Okay, great. All right, great. If you could just let your knees hang straight, check your reflexes. Okay, very good. Now what I'm going to do is I'm going to have you close your eyes, and I'm going to touch you with a soft tip, and I just want you to tell me where I'm touching you.
Left arm. Chest. Right arm. Left foot. Right foot. Forehead.
Perfect. If you could just keep your eyes closed and open up one of your hands. I'm going to put something in your hand, and I want you to tell me what it is.
Battery.
Okay. And tell me what that is.
A safety pin.
And then tell me what this is with one in the hands.
Bubble wrap.
Very good. Thank you. Now you can open up your eyes. We did the reading test, right? Okay. So now what I'm going to have you do is I'm going to have you stand up for me. Okay. And I'm just going to have you bend forward so I can check your spinous process again and again. Nice and even. I don't see any abnormalities. I don't feel any masses, and nothing hurts back here, correct?
Nope.
Okay. So I'm going to have you stand up. I'm going to do check for the Romberg sign. I'm going to have you close your eyes for 20 seconds, and I'm just going to stay near you in case you get dizzy. Okay, great. All right, so now what I'm going to have you do is I'm going to have you just walk across the room. All right, and turn around and walk to me, heel in front of your foot. Yep, heel to toe. Okay, now turn around and walk on your tippy toes. And now walk back to me on your heels. All right, very good. And I think we're done. So thank you very much for volunteering today.